Welcome back, everyone. I am so happy you are here with me today. If this is your first time on the channel, pull up a chair and make yourself comfortable. I'm Susan. I've been working in the Social Security and Medicare system for over 20 years, helping thousands of seniors navigate one of the most confusing bureaucracies in America. I have sat across the desk from retirees who were in tears because of a single missed deadline. I have helped people untangle paperwork nightmares that cost them thousands of dollars. And I have watched far too many times as good, honest people got blindsided by rules they never knew existed. Today, we need to have a very important conversation about Medicare enrollment. Specifically, we need to talk about the mistakes that can haunt you financially for the rest of your life. I know that sounds dramatic, but I promise you I'm not exaggerating. Medicare has some of the strictest deadlines in the entire federal benefit system, and the penalties for missing them are not temporary, they are permanent. They follow you for as long as you have Medicare, which for most of us means forever. Here is the thing that frustrates me the most. These mistakes are almost always preventable. People make them not because they are careless, but because the rules are complicated, the terminology is confusing, and nobody sits you down and explains what you need to know. That changes today. So grab a cup of coffee, maybe get a notepad, and let's walk through the 5 Medicare enrollment mistakes that can cost you for life. I am going to explain exactly what each penalty is, how it gets calculated, and most importantly, how you can avoid it entirely. Let's start with the foundation because I want you to understand why these deadlines matter so much. Medicare operates on very specific enrollment windows. Your initial enrollment period is a 7-month window that starts 3 months before the month you turn 65 and ends 3 months after. This is your golden window. This is when you have the most options, the fewest restrictions, and zero penalties. Once this window closes, everything gets harder and more expensive. The government designed it this way intentionally. They want people to enroll when they first become eligible, not wait until they get sick. So they built in penalties to discourage people from gaming the system. The problem is that these penalties catch a lot of innocent people who simply did not understand the rules. Let's get into mistake number 1. Mistake number 1, missing your Part B enrollment window Medicare. Part B covers your doctor visits, outpatient care, and medical equipment. If you do not sign up for Part B when you are first eligible, and you do not have what is called creditable coverage through an employer, you will be charged a late enrollment penalty. Here is how brutal this penalty is. You pay an extra 10% on your Part B premium for every 12-month period you could have had Part B but did not. And this penalty never goes away. It stays with you for as long as you have Medicare. Let me give you a real example. Say you delayed signing up for Part B by 3 years because you did not think you needed it. You were healthy. You figured you would wait until something came up. When you finally enroll, you will pay a 30% penalty on top of your standard premium every single month for the rest of your life. In 2025, the standard Part B premium is $185 per month. With that 30% penalty, you are now paying about $240 per month. Over 20 years of retirement, that mistake cost you over $13,000 in extra premiums alone. I had a gentleman come to me last year who had delayed Part B for 5 years. He was healthy at the time and did not want to pay the premium. By the time he enrolled, his penalty was 50%. He sat in my office and said, "Susan, nobody told me. Nobody warns you." And he was right. Nobody does. Mistake number 2, going without Part D prescription drug coverage. Even if you do not take any medications right now, skipping Part D can cost you dearly down the road. Medicare, Part D covers prescription drugs, and it has its own late enrollment penalty that is separate from Part B. If you go more than 63 days without creditable prescription drug coverage, meaning coverage that is at least as good as standard Part D, you will owe a penalty when you do eventually sign up. The penalty is calculated as 1% of the national base beneficiary premium for every month you are without coverage. In 2025, that base premium is about $36.78. So if you went 5 years without Part D coverage, that is 60 months times 1%, which equals a 60% penalty. That does not sound like much until you realize it is added to your premium every single month for as long as you have Part D coverage. And here is what catches people off guard. You might be perfectly healthy at 65 and think you do not need drug coverage, but at 75, when you suddenly need medications for blood pressure or cholesterol or diabetes, that penalty is waiting for you. I cannot tell you how many people have told me they wish they had just gotten an inexpensive Part D plan from the start. Even if you do not use it, having that coverage protects you from the penalty later. Mistake number three, assuming your employer coverage protects you. This is where things get really tricky, and it is where I see the most confusion. Many people continue working past 65 and assume that as long as they have health insurance through their employer, they are fine. They can delay Medicare without penalty. That is true, but only under very specific circumstances. Your employer must have 20 or more employees, and your coverage must be based on current active employment. If your company has fewer than 20 employees, Medicare is considered your primary coverage, and you need to sign up when you turn 65 or you will face penalties. Here is another trap. COBRA coverage does not count as creditable coverage for avoiding the Part B penalty. Neither does retiree health insurance from a former employer. I have seen so many people assume their retiree benefits meant they could delay Medicare. They were wrong, and they are now paying penalties for life. Before you decide to delay Medicare enrollment, you need to verify two things. First, does your employer have 20 or more employees? Second, is your coverage based on current employment, not retirement? If you cannot answer yes to both questions, you need to sign up for Medicare during your initial enrollment period. Mistake number four, missing your Medigap open enrollment window. Now we have arrived at mistake number four, and this is the one I really want you to pay attention to because it is different from the others. This one does not come with an official government penalty. Instead, it can lock you out of affordable coverage entirely. When you enroll in Medicare Part B at age 65, you get a special 6-month Medigap open enrollment period. During this window, and only during this window, insurance companies must sell you any Medigap policy they offer at the best available rate. They cannot reject you. They cannot charge you more because of pre-existing conditions. They cannot make you wait for coverage. Once that 6-month window closes, everything changes. Insurance companies can deny you coverage based on your health history. They can charge you significantly higher premiums. They can impose waiting periods of up to 6 months before covering any pre-existing conditions you have. If you have diabetes, heart disease, cancer, or any chronic condition, you may find yourself completely unable to get a Medigap policy at any price. I had a woman come to me who had delayed getting a Medigap plan because she wanted to save money on the premium. She was 67 and had recently been diagnosed with a heart condition. When she tried to apply for Medigap, every single company denied her. She was stuck with original Medicare and its 20% coinsurance on everything, with no cap on her out-of-pocket costs. One hospital stay could have bankrupted her. Your Medigap open enrollment period is a one-time opportunity. It does not come back around every year like the regular Medicare enrollment periods. If you miss it, you may never get another chance to buy comprehensive supplemental coverage. This is the mistake that keeps me up at night because there is no penalty to pay your way out of it. The door simply closes. Mistake number five, not understanding what creditable coverage actually means. I have mentioned creditable coverage several times already, and I want to make sure you truly understand this term because misunderstanding it is what causes most of these penalty situations. Creditable coverage is insurance that Medicare has determined is at least as good as standard Medicare coverage. For Part B purposes, it typically means group health coverage from an employer with 20 or more employees where you are actively working. For Part D purposes, it means prescription drug coverage that meets certain actuarial standards. Every year, if you have drug coverage from another source, your plan administrator is required to send you a letter telling you whether your coverage is creditable. If you receive that letter, keep it. Store it somewhere safe. If you ever need to prove you had creditable coverage to avoid a penalty, that letter is your evidence. Here is where people get into trouble. They assume their coverage is creditable without verifying. They throw away the notice. They switch plans and have a gap of more than 63 days. Then when they try to enroll in Medicare, they cannot prove they had creditable coverage and the penalty applies. Do not assume. Verify every single year. Let me give you a quick action plan. If you are approaching 65, mark your initial enrollment period on your calendar right now. It starts 3 months before your birthday month and ends 3 months after. If you are still working with employer coverage, verify that your employer has 20 or more employees and that your coverage is based on active employment. Consider enrolling in Part A at 65 even if you delay Part B, since Part A is premium free for most people. Get a Part D plan even if you do not take medications. And please, during your 6-month Medigap window, at least explore your options. You do not have to buy immediately, but know what is available while you still have guaranteed access. If you have already missed a window and are facing a penalty, do not lose hope. There are sometimes special enrollment periods that can help, and a good Medicare counselor can review your situation. Every state has a free state health insurance assistance program called SHIP, with trained counselors who can help you navigate your options. I know this is a lot of information, and I know it can feel overwhelming, but I promise you, taking an hour to understand these rules now can save you thousands of dollars over your retirement. The Medicare system rewards people who plan ahead and penalizes those who wait. Do not let a simple misunderstanding cost you for the rest of your life. In my next video, I am going to be walking you through the income-related surcharges that can dramatically increase your Medicare premiums if you are not careful with your retirement income planning. If you had a good year with capital gains or Roth conversions, you need to know how that affects your Medicare costs 2 years later. Thank you so much for spending this time with me today. If you found this helpful, please subscribe so you do not miss the next one, and share this with anyone you know who is approaching 65. They will thank you for it. Stay informed, stay protected, and I will see you in the next video. Bye, everyone.